Which of the following techniques is best for promoting independence in a patient? A. Doing everything for the patient. B. Encouraging the patient to do as much as they can. C. Not allowing the patient to move. D. Ignoring the patient's attempts at self-care. Answer B. Encouraging patients to perform tasks independently, when possible, promotes self-sufficiency. If a patient becomes angry and agitated, the best way to respond is to A. Argue with the patient. B. Leave the patient alone until they calm down. C. Restrain the patient immediately. D. Remain calm and try to understand the cause of their anger. Answer D. Remaining calm and addressing the cause of the anger can help de-escalate the situation. A patient should be turned and repositioned at least A. Once per day. B. Every 2 hours. C. Every 8 hours. D. Every 12 hours. Answer B. Repositioning every 2 hours helps prevent pressure ulcers in patients who are bedridden. Which of the following foods should be avoided for a patient on a low-sodium diet? A. Canned soups. B. Fresh fruits. C. Whole grains. D. Green vegetables. Answer A. Canned soups are often high in sodium and should be avoided by patients on a low-sodium diet. The Heimlich maneuver is used to A. Restart the heart. B. Control bleeding. C. Treat choking. D. Stabilize a broken bone. Answer C. The Heimlich maneuver is performed to help dislodge food or objects blocking the airway during choking. The proper term for a blood pressure reading of 140/90 mmHg or higher is A. Hypertension. B. Hypotension. C. Normal. D. Tachycardia. Answer A. Blood pressure readings of 140/90 mmHg or higher indicate hypertension, or high blood pressure. When assisting with a bedpan, you should A. Place the bedpan at the foot of the bed. B. Ensure privacy for the patient. C. Leave the patient alone for an hour. D. Place the bedpan in the upright position. Answer B. Providing privacy helps maintain the patient's dignity and comfort when using a bedpan. When using oxygen therapy, it is important to A. Keep the oxygen tank near heat sources. B. Ensure there are no kinks in the tubing. C. Turn off the oxygen between breaths. D. Only use the oxygen at night. Answer B. Kinks in the tubing can obstruct the flow of oxygen, making the therapy ineffective. A patient has been diagnosed with congestive heart failure, CHF. This means their heart A. Pumps blood too quickly. B. Has stopped pumping. C. Is unable to pump blood efficiently. D. Is working perfectly. Answer C. In congestive heart failure, the heart cannot pump blood effectively, leading to fluid buildup in the body. A high fever is generally defined as a temperature of A. 100 degrees Fahrenheit 37.8 degrees Celsius. B. 99 degrees Fahrenheit 37.2 degrees Celsius. C. 101 degrees Fahrenheit 38.3 degrees Celsius. D. 102 degrees Fahrenheit 38.9 degrees Celsius or higher. Answer D. A high fever is typically considered to be 102 degrees Fahrenheit 38.9 degrees Celsius or higher and may require medical attention. A patient complains of pain while urinating. This is known as A. Hematuria. B. Dysuria. C. Polyuria. D. Oliguria. Answer B. Dysuria refers to pain or discomfort while urinating, which can be a symptom of a urinary tract infection. To assist a patient with a weak side when walking, you should A. Walk on the patient's strong side. B. Walk on the patient's weak side. C. Walk directly in front of the patient. D. Walk behind the patient. Answer B. Walking on the weak side helps support and stabilize the patient while walking. If a patient shows signs of a possible stroke, you should A. Ignore the signs. B. Administer pain medication. C. Wait for the symptoms to improve. D. Call emergency services immediately. Answer D. A stroke is a medical emergency, and immediate action is required to minimize damage and improve outcomes. A patient has just eaten. How long should you wait before taking an oral temperature? A. 5 minutes. B. 15 to 30 minutes. C. 1 hour. D. Immediately. Answer B. Waiting 15 to 30 minutes allows the patient's mouth to return to its normal temperature, ensuring an accurate reading. Which of the following is an early sign of dementia? A. Confusion and memory loss. B. Increased energy levels. C. Improved social interaction. D. High fever. Answer A. Early signs of dementia include confusion, memory loss, and difficulty performing daily tasks. Difficulty in breathing is called A. Apnea. B. Cheyne-Stokes respirations. C. Dyspnea. D. Orthopnea. Answer C. Dyspnea refers to the medical term for difficulty breathing, which is often observed in patients with respiratory conditions. The patient has voided QS. This means that she has urinated. A. Not enough. B. Enough. C. Too much. D. Not at all. Answer B. The abbreviation QS stands for quantum satis, meaning an adequate or sufficient quantity. Your care plan calls for you to take vital signs QID. This means you should take them. A. Once a day. B. Twice a day. C. 4 times a day. D. Every 4 hours. Answer C. The abbreviation QID stands for quater and die, meaning 4 times daily. The abbreviation BID stands for A. Bath in daytime. B. Once a day. C. Twice a day. D. 4 times a day. Answer C. BID is the medical abbreviation for bis and die, which translates to twice a day. The abbreviation HS means A. After hours. B. Head shave. C. At bedtime. D. Drops. Answer C. HS stands for orasomni, which means at bedtime. The abbreviation AC means A. Before meals. B. 1/2. C. After meals. D. After care. Answer A. AC is the medical abbreviation for anti-SIBM, meaning before meals. The client chart is considered to be A. A legal document. B. A record of the care given. C. A record of observations of the client's condition. D. All of the above. Answer D. Client charts serve as legal documents, a record of care, and a place for observations about the client's condition. Which of the following symptoms is considered subjective? A. Vomiting. B. Nausea. C. Skin breakdown. D. Rapid pulse. Answer B. Subjective symptoms are those that the patient reports but cannot be observed directly, such as nausea. During a first job interview, it is important that you learn about A. The salary. B. Vacation time. C. Fringe benefits. D. Job responsibilities. Answer D. Understanding the responsibilities of the role is crucial to ensure you're a good fit for the job. In an interview, the employer will look for evidence of A. Neatness, enthusiasm, and responsibility. B. Hard work, leadership, and competence. C. Training, reliability, and availability. D. All of the above. Answer D. Employers seek employees who demonstrate neatness, enthusiasm, hard work, reliability, and relevant training. You should always take a rectal temperature if the client is A. Awake. B. 3 years old or under. C. Uncooperative. D. Over 60 years old. Answer B. Rectal temperatures are commonly taken for infants and very young children due to their accuracy. The amount of fluid a client takes in during an 8-hour period is called A. Fluid output. B. Edema. C. Fluid intake. D. Patient I&O. Answer C. Fluid intake refers to the amount of fluid consumed by the patient. One full count of a respiration includes A. 1 inhalation and 1 exhalation. B. 2 inhalations and 1 exhalation. C. 1 breath. D. 1 exhalation. Answer A. A full respiration is counted when the client completes both an inhalation and exhalation. If a client experiences sudden chest pain, you should A. Ignore it. B. Stop what you're doing and alert your supervisor. C. Ask the client to take deep breaths. D. Continue as normal and monitor. Answer B. Chest pain can be a sign of a serious condition and should be immediately reported to the supervisor. The best way to move a patient safely is to A. Use your back muscles. B. Use your legs and keep your back straight. C. Bend at the waist. D. Lift using your arms. Answer B. Proper body mechanics prevent injury. You should use your legs and keep your back straight when lifting.